Hi everyone, this is Care and Cure for a simple and reliable nursing education. Most of the time, caregivers and nursing students are facing various difficulties regarding the medication administration procedures. So today I am going to discuss with you about 5 simple tips how to make your struggle more easily, how to understand or do the things correctly. Tip 1. You have to follow the 6 rights. I am quite sure you are already familiar with the 6 rights. So first and the most important rule in medication administration is the use of 6 rights of medication administration. So you have to always check whether you are giving the medication to the right patient, whether you are deciding the right drug, the right dose, right route, right time and right documentation. So you must not skip this step even if you are in a hurry, even though you are in a great hurry. You are very busy person, you have many patients to look after. Even so, you have to follow the 6 rights. Then second tip, you have to read the drug name properly. As you already know, many drug names look or sound similar. There are few types of medication, tablets or capsules that look same, and there are few brand names or generic names that sound similar. So before giving the drug, before taking the drug, you have to read the drug name properly. You have to read the drug name and do the 3 checkings at least. If you are not sure, sometimes the prescription may be not clear. Sometimes the doctor's handwritings are not clear, the printed things are not clear. So if you are unsure, you have to stop and ask. Always clear your doubts. This is another very important tip. Then know the route of administration. We have already discussed about some main routes of medication administration. So medications can be administered by the oral route, subcutaneous route, nebulization, inhalers and all these things. So each route is different. Some medications are designed as tablets, capsules, inhalers and subcutaneous injections. So you should never give a drug by a route you are not confident about. If you have only trained about subcutaneous injections, you can't give the medication using IV route. If you don't know things, you have to avoid using those routes. If you are not confident, tell the person who asked you to do the procedure that you are not confident. If not, you are doing a harm to your patients and you will have to face the consequences. Then after giving the medication, after administering the medication, you have to observe the patient. That is very essential. So your duty does not end after giving the drug. Just medication administration is not only the thing you are responsible of. Medication administration itself is a process, right? So if it is a process, monitoring part, observing part of the patient is also included in the process. So you have to always observe your patient for allergic reactions, dizziness, breathing difficulty or any unusual symptoms. These early observations can save a life. If the patient is having allergic reactions, you have to identify the allergic reaction in the first few seconds. If you are quite observant about these things, you can protect your patient's life. That is very important. Then documentation. You have to do the documentation immediately. Documentation is also a part of medication administration procedure. So after giving the medication, you have to record it correctly. The date, time, the dose, the medication, the time you have administered, Any side effects you observed, what is the response from the patients, you have to record it. You have to record it immediately after administering drugs. The thing with the documentation is that if you give the drug, if you administer the drug, you have to do the documentation immediately. If not, you will forget things. Never delay documentation. If you delay the documentation, other things, someone can again give the medications within the delay time, or you may forget to document. So you have to document the procedure immediately.